Welcome to the Concierge Care Health System podcast. The information shared in this podcast is for general informational purposes only and does not constitute medical advice. Listeners should be aware the content is not a substitute for professional medical advice, diagnosis, or treatment. Always consult with a physician or other qualified healthcare provider for medical questions.
Welcome back to the deep dive. You know how sometimes a topic is right there, staring us in the face, kind of demanding our attention, but we're not truly seeing it, not really getting the full picture. Well, today we're going to unpack something incredibly vital and, frankly, pretty heartbreaking. We're talking about the critical public health challenge of men's mental health.
That's a huge one.
Yeah. Our mission today is to really try and understand why. Why do men often struggle in silence? We want to pull back the curtain on, the societal stuff that contributes, and crucially, how we can shift the conversation around male vulnerability and, well, what it actually means to be strong.
Right.
We've got a stack of fascinating research and analyses here, and I'm genuinely excited to get into these insights with you.
It's definitely a critical deep dive, and what our sources lay out really right from the start is this incredibly stark paradox.
Paradox, yeah.
We're looking at what many call a silent epidemic. You've got men being diagnosed with depression at much lower rates than women.
Right, lower diagnosis.
But sadly, they have disproportionately higher suicide rates. Our research gives a pretty comprehensive look at why this disconnect exists and, importantly, how gender-sensitive campaigns are actually trying to tackle it head-on.
Okay.
It's an issue with, profound real-world consequences. It needs our attention, yes, but also our active understanding.
Okay, let's unpack this then.
Yeah.
Because these numbers, they are really shocking, aren't they?
They really are.
Our sources highlight it clearly. Men diagnosed less often with depression, but dying by suicide at a rate 4 times higher than women.
4 times, yeah.
Just think about that. In the U.S. alone, men account for nearly 80% of all suicide deaths. That stark paradox you mentioned.
Yeah.
It's not just a number. It's this huge overlooked gap in how we understand and maybe respond to male suffering.
And if we connect this to the bigger picture, the key takeaway isn't that men suffer less or that they're somehow, immune to distress. It's profoundly about men suffering differently. And our current systems, our societal expectations, even our clinical diagnostic tools, they're often just not set up to recognize it.
Oh, they miss it.
They miss it. This disconnect, it's deeply tied to what we call gender socialization, the whole process of learning what it means to be a man or a woman in our society. And this shapes everything, how men experience distress, how they express it, and ultimately how or even if they seek treatment. So yeah, very often male suffering just becomes invisible.
And that invisibility, that leads us right into what a lot of the research calls the male code of distress.
Yeah, that's a key concept.
And it's crucial because male psychological distress, especially something like depression, it often just doesn't show up in ways that fit the prototypical checklist we might expect.
Right, the standard picture.
We tend to think of depression as, deep sadness, maybe crying, or that thing, anhedonia, the inability to feel pleasure. But for so many men, it just doesn't look like that on the surface.
Exactly. Our sources detail these often missed sort of male-typical externalizing symptoms. So instead of obvious sadness, you might see frequent angry outbursts.
Anger. Yeah.
Or this heightened, almost constant irritability, intense frustration over stuff that might seem kind of minor to other people.
Okay.
And this can even escalate into controlling behavior or, sadly, in some cases, abusive behavior. The sources are clear, this isn't just bad behavior, it's often a maladaptive expression of really deep underlying turmoil.
Right, it's a sign of something deeper.
Then you've got the escapist behaviors. Think about the guy who just throws himself into work, becomes a total workaholic, maybe to avoid emotional stuff, or the one who disappears into intense sports or hobbies, just pouring all his energy there. Substance misuse is a big one too. Alcohol, drugs often used to self-medicate, numb the anxiety or depression.
Yeah.
And high-risk behaviors, things like reckless driving, extreme sports, that can also be a sign of this internal distress, maybe a way to feel something other than pain, or maybe even a subconscious cry for help.
And it's not just behavioral, is it? The sources also talk about physical symptoms, the somatic ones.
Oh, absolutely. Very common.
Like men experiencing chronic headaches more often, or persistent back pain, digestive issues.
Yeah.
Just that constant nagging fatigue you can't shake.
Yeah, exactly. And what's really striking here is that men will often diligently seek help for those things. They'll go to the doctor for the back pain, for the headaches, try every test.
Right. They address the physical,
While the underlying emotional distress, the actual root cause, goes completely unaddressed. It's hidden, behind this physical mask.
which creates what the sources call this critical diagnostic gap.
Precisely. Because men's distress doesn't neatly fit the standard clinical picture that our diagnostic tools are often calibrated for. It frequently goes unrecognized, and not just by the men themselves or their families, but critically by healthcare professionals too.
That's a big problem.
It is. And look, this isn't some inherent biological thing. It's largely a social construct. Our culture, in many ways, it kind of punishes sadness or vulnerability in men, right?
Oh, yeah, boys don't cry.
Exactly. But it often tolerates or even sort of encourages those externalizing things like anger or stoicism or just working yourself into the ground.
Right.
So consequently, our clinical systems have historically been set up to spot a more, let's say, feminized presentation of depression, which makes male suffering practically invisible within the very structures meant to help.
So it raises that important question you mentioned.
Yeah.
If we're not looking for the right signs, how can we possibly find the problem?
Exactly. And the consequences are, well, tragically, often lethal. Men are much less likely to show those classic verbal warning signs we associate with suicidal thoughts. But when they do decide to act, they tend to use more lethal means and often act very impulsively. There's very little time, often, for anyone to intervene.
It's so clear that underneath all of this diagnostic gap, is what the sources call the man-up mentality, or, more formally, hegemonic masculinity.
Yep, that's the bedrock.
And the sources define it pretty clearly. It's that dominant set of cultural ideas about being a man. Things like, unwavering toughness, total emotional control, stoicism no matter what, being completely self-reliant, and just avoiding vulnerability at all costs. We've all heard it growing up. Boys don't cry, suck it up, man up.
Yeah.
It's not just a phrase, is it? It feels like the core barrier we're really up against here.
Absolutely. And this creates this intense, often really devastating internal conflict for men when they do face mental health challenges.
How so?
Well, just acknowledging any kind of distress, let alone actually asking for help, it gets perceived as a profound failure of self-control.
Like you failed at being a man.
Exactly. A direct contradiction to those masculine ideals. It feels like a forfeiture of masculine identity itself.
Yeah.
So it's really no wonder there's such a widespread reluctance to seek help. And beyond that internal struggle, men worry. They worry a lot about the social and professional fallout. Damaging their career, losing respect from family, friends, partners.
And those fears aren't just in their heads, are they?
Often not, no. They can be quite well founded in a society that still often equates emotional expression in men with weakness.
So it's almost like this double jeopardy situation the sources talk about.
Explain that.
Well, the very norms and expectations that are contributing to the distress in the first place, like suppressing emotions, the pressure to be strong all the time, not having deep emotional connection, those are the exact same norms that then block access to the support that could actually help fix the distress.
Ah, right. It's a vicious cycle.
Yeah, a self-perpetuating trap that keeps men silent.
Yeah. But what's fascinating here, and the sources bring this out, is a really crucial nuance. Not all masculine traits are inherently bad or harmful. Some, actually, if you reframe them skillfully, can help with help-seeking.
How does that work?
Well, think about that drive. Many men have to be, say, a competent provider or a decisive problem solver, someone who takes charge.
Right. Those are often seen as positive masculine traits.
Exactly. So you can leverage that. Instead of framing therapy as admitting weakness, you frame it as a proactive, strategic step, like fixing a problem or optimizing your mental fitness so you can stay strong and capable for your family or your job.
Ah, so you're aligning it with existing values?
Precisely. It's about redefining the healthier aspects of masculinity and making help-seeking fit with those strengths rather than demanding men completely abandon their sense of identity.
But what our sources get into next really flips the script, doesn't it, on how we usually think about strength.
Yeah, this is where Brene Brown's work comes in.
Right, offering this profound kind of theoretical antidote to that ideal of masculine invulnerability. Her definition of vulnerability, it's not weakness at all.
Quite the opposite.
She defines it as uncertainty, risk, and emotional exposure.
Right.
And her key finding, the really transformative one, Vulnerability isn't the opposite of courage. It's the absolute birthplace of courage.
Yeah.
That's a total game changer.
It absolutely is. And this framework, it directly challenges that hegemonic masculinity we were just talking about head on.
How so?
Well, that armor men are often taught to wear the stoicism, the rigid emotional control. Fundamentally, it's a defense mechanism. It's protection against shame.
Shame.
And
Yeah.
Brown defines shame as that intensely painful fear of disconnection, that agonizing belief that we're somehow flawed, unworthy of belonging. For men, this shame often gets triggered by the fear of appearing weak or inadequate or not good enough, all direct violations of that traditional male code.
Right.
But here's the tragic irony. While that armor might feel protective, it simultaneously blocks genuine human connection. And connection, as the sources really emphasize, is absolutely essential for mental well-being. You can't connect if you're constantly shielded.
So the core message becomes this really powerful, almost revolutionary idea. Reframing vulnerability is the ultimate demonstration of strength.
Exact.
It's the courage to, as she says, enter the arena, to show up and be seen, even with all your flaws and fears. It's about a deeper kind of courage, one that can replace that damaging, isolating stoicism.
Being brave enough to be real.
Yeah.
Now, for campaigns to actually translate this new way of thinking into real behavioral change, they need to get good at the mechanics of normalization and stigma reduction.
Okay. How do they do that?
Well, our sources point to something called reason-action approaches. Basically, campaigns work best when they first change what a person believes about a behavior, like believing that seeking help is strong, not weak.
Right. Change the belief.
And then they need to influence what that person thinks their peers and society find acceptable. It's kind of a two-step nudge towards change.
Makes sense.
Normalization is absolutely key here. By showing relatable stories, ordinary guys navigating mental health challenges campaigns, reduce that feeling of isolation. They show it's a normal part of the human experience.
Like you're not alone in this.
Exactly. And reducing stigma effectively.
Yeah.
It isn't about directly talking about stigma all the time. Sometimes that can even backfire.
Oh, interesting.
Instead, it's about subtly but powerfully showcasing stories of hope and recovery, especially hearing those stories from respected people, public figures, peers, role models who embody this new, healthier vision of male strength.
And what's really insightful is that these campaigns, they aren't just targeting the men who are struggling, right? They're also aiming at their whole social circle.
Crucial point, yeah. Partners, friends, family, colleagues, they are vital allies in creating that supportive environment.
Yeah, and the sources mentioned Movember's ALEC model, ask, listen, encourage action, check in.
Right, ALEC, it's a great practical tool.
It empowers just regular people in the community to actually start those conversations, to create safer spaces for men to open up. That feels absolutely vital.
It is. Moving from the theory into practice, our sources then lay out some really clear, actionable principles for designing campaigns that actually work for men. These aren't just guesses. They're based on research and successful programs.
Okay, so building on all that, what are some of those key strategies? How do you engage men effectively?
Well, the first principle is male-sensitive language. This isn't just picking words, it's about making it possible to even start the conversation.
Right.
So avoiding clinical jargon, maybe avoiding overly emotional terms, instead using phrases that connect with men's actual experiences like mental fitness or burnout or stress management.
Burnout. Yeah, I can see how that would connect more than maybe major depressive episode for a lot of guys.
Exactly. It's an easier entry point. And interestingly, humor is highlighted as a really powerful tool. It can disarm that natural defensiveness and just open the door a crack.
Okay, what else?
Next, activity-based engagement. Lots of men bond and communicate more comfortably doing something together, shoulder to shoulder, rather than sitting face-to-face in an office.
Yeah, fixing a car, watching a game.
Right. So campaigns integrated into sports teams, hobbies, or community programs like men's sheds, where guys gather to work on projects. They create these natural, low-pressure settings for conversations to just happen.
Makes sense. Go where the guys are.
Which leads to the third principle, safe and familiar settings. Get the interventions out of the formal, maybe intimidating clinics, and put them in places where men already feel comfortable. Workplaces, sports clubs, community centers, maybe even the local pub. It just lowers that barrier to entry.
Okay.
Then peer support and lived experience, the messenger really matters. Hearing from someone who's actually been through it, navigated their own struggles, that's incredibly credible.
Much more than some expert they don't know.
Often, yes. They build trust much faster. And group settings, especially with peers, they foster that sense of shared identity, like, we're in this together. And finally, digital platforms for anonymity. For the guys who are really hesitant about face-to-face help, and we know that's a lot of them, online tools, apps, self-assessments, they offer a private, low-stakes first step.
So they can check things out on their own time.
Exactly. Explore concerns anonymously, get information, start to understand what's going on without the immediate pressure of talking to someone.
That all makes so much sense. It's about meeting men where they are. And the sources actually look at 3 big campaigns that have done this stuff well: Movember, Man Therapy, and His Heads Together.
Yeah, it's great to see these principles in action. First, Movember, probably best known for the mustache growing in November, right?
Yeah, the mouth.
Which is brilliant. It's a visible, fun conversation starter, but it links directly to a serious cause. And it's grown way beyond that now, providing concrete tools like that ALEC guide we mentioned, fostering conversations, boosting health literacy all over the world. It normalizes the chat through this shared, visible thing.
Okay, and Man Therapy. That sounds interesting.
It really is innovative. It specifically targets working-age men who might be resistant to the whole idea of therapy. It uses humor and these kind of strong masculine archetypes, like the main character, Dr. Rich Mahogany, this sort of no-nonsense therapist figure.
Okay.
And it uses that humor to destigmatize mental health. It's mainly digital with interactive tools like a 20-point head inspection, asking things like, are you feeling more irritable than usual? Instead of, are you sad?
Right, using that male-sensitive language.
Exactly. And what's really impressive is it's been rigorously tested with randomized controlled trials, RCTs. And those studies showed it actually reduced suicidal thoughts in participants. That's real impact.
Wow, that's powerful evidence. And Heads Together.
Heads Together. And its spin-off Heads Up, they took a different tack. They leveraged really high-profile endorsements like members of the royal family in the UK.
Right, William and Harry were involved.
Yeah, using their influence for mass stigma reduction. And strategically, they embedded mental health messages right into male-dominated culture, especially football, through the Heads Up campaign. That created a huge national conversation and led to lasting services, like the Shout text line for mental health support. Shows the power of big voices and cultural integration.
So, looking at these different campaigns, the big takeaway seems to be, as the sources really hammer home, that a single campaign model is insufficient.
Absolutely not one size fits all.
You need this whole ecosystem approach, right? A mix of different campaigns working together, reaching men in different ways, speaking their language, meeting their specific needs.
And if we connect this back to the bigger picture, effective campaigns aren't just about raising awareness or getting clicks online. They have to demonstrate real-world, measurable change.
Which brings us to the tricky part: evaluation.
Right. The sources really stress that assessing success has to go beyond awareness. You need solid methods. Things like scoping reviews, basically mapping out all the existing evidence so you know what's already been tried and tested.
Okay.
Then you need randomized controlled trials, those RCTs again. They're the gold standard for proving cause and effect, showing that the campaign actually caused the positive change.
Right, not just correlated with it.
Exactly. And ideally, mixed methods approaches, combining the hard numbers, the quantitative data with the rich stories and context you get from qualitative insights, interviews, focus groups. That gives you the full picture, not just what changed, but why and how. Understanding the real nuance of the impact.
And beyond just measuring if it works, there's some really important ethical things to think about when designing these campaigns, aren't there?
Oh, absolutely. It's a very delicate balance. One major risk is accidentally reinforcing stereotypes.
How?
Well, there's a fine line, as the sources say, between using male-friendly language and subtly propping up those harmful old ideas about masculinity we're trying to change. The best campaigns, the ethical ones, they cleverly subvert the tropes. They use familiar language to build trust, but then gently introduce a healthier idea, like vulnerability being strength.
Okay, that makes sense.
What else? Another huge imperative is intersectionality. Men aren't all the same. Campaigns have to be culturally sensitive. They need to recognize the unique barriers faced by men from different backgrounds, race, ethnicity, sexual orientation, socioeconomic status.
Right.
The sources specifically mention Black men, for example, often facing these dual burdens, navigating the tough masculine norms and dealing with systemic racism. That adds whole layers of complexity to seeking help that campaigns need to understand and address.
That's critical.
Then there's the huge responsibility to connect to services. It's ethically really questionable illegal, frankly irresponsible to raise awareness and tell men to seek help if there aren't accessible, affordable, culturally appropriate services ready for them.
Yeah, you can't create demand without supply.
Exactly. It just leads to frustration, maybe even makes things worse. Campaigns have to be integrated with clear pathways to actual care.
Okay.
And finally, informed consent and data privacy. Especially with all the online tools collecting sensitive information, campaigns need crystal clear policies on how data is used and really robust procedures for following up if someone indicates they're in serious distress online. Trust is absolutely vital.
So putting all this together, the complexities, the ethics, the lessons from successful campaigns, what are the actual recommendations? How do we build this cohesive ecosystem of support for men's mental health? Who needs to do what?
Well, the sources provide some really clear, actionable recommendations for different groups. For public health bodies, it's not just about funding diverse campaigns. They need to mandate rigorous evaluation, pushing beyond just awareness metrics to really understand the impact using those mixed methods we talked about. It's about smart investment in well-being.
Right, ensuring the money makes a difference.
For healthcare providers and systems, that diagnostic gap has to be closed, period. That means comprehensive training for all clinicians on spotting those male-typical symptoms, encouraging gender-sensitive communication, and redesigning clinics to feel more welcoming and less judgmental for men. The sources actually call it a catastrophic failure when men who die by suicide have recently seen healthcare professionals but weren't identified or helped properly. That needs systemic change.
Wow, catastrophic failure. Strong words.
That highlights the urgency.
Yeah.
Then, community organizations. They should be supported to embed mental health promotion right into places where men already are, workplaces, sports leagues, clubs, and train peer responders using models like ALIC. Leverage that power of men supporting men.
Okay.
And finally, for researchers, the call is to really prioritize intersectionality, study the diverse experiences of men, develop and validate new screening tools designed for externalizing and somatic symptoms, and critically, conduct more high-quality RCTs to build that solid evidence base for what really works.
So, bringing this all together, what does this really mean for us, for you listening? This deep dive, it really shows this crisis isn't about men being inherently weak, is it?
Not at all.
It's more like a tragic outcome of a cultural script that tells men to hide distress and equates vulnerability with failure.
Yeah.
It really points towards this dual approach we need, re-educating everyone on what male distress actually looks like, and at the same time, championing vulnerability as a genuine, maybe the ultimate form of strength.
Precisely. And look, this whole project, it isn't just a public health issue. It's really a fundamental step towards redefining masculinity itself for a healthier, more connected 21st century, and that has truly life-saving implications.
Yeah.
Awareness campaigns are a great catalyst, a starting point, but real, lasting success needs that whole systemic shift, a healthcare system that sees male distress, and communities where men feel not just safe, but actually encouraged to be vulnerable. It's about fundamentally rebuilding our understanding of strength.
Thank you so much for joining us on this deep dive into men's mental health. We really hope this conversation helps you think about how you might apply some of this understanding in your own life, in your interactions, maybe in your community. And as our sources kind of provoke us to think about at the end, how can we all contribute to creating an arena where men are not only permitted but actively encouraged to step into their own emotional lives, to truly show up and be seen?
That's the question.
Yeah, think about that and what it might mean for the men in your life and really for all of us.
Concierge Care, providing world-class, personalized care for patients and members. Taking a proactive approach by offering its free digital health clinic for anyone in need of these services. Reach out to us via our website, www.health.conciergecare.net, or give us a phone call at 786-809-2345.